technique that allows you to look at your breast, feel your breast for any physical or visual changes. So it's done in 2 positions. So lying down, you use the 3 middle fingers, 1, 2, and 3, and you sort of divide the breast into 4 quadrants, and you do a circular motion, kind of going up and down on each of the 4 quadrants. When you're done with 1 quadrant completely, you move to the next quadrant, the 3rd quadrant, and the 4th quadrant, and then you also feel the nipple areola area. So you do that lying down, and then you stand up, you look in the mirror, you put your hand behind on your hips like this, and make sure that your breasts look normal, that there's no pulling in, what we call retraction. There's no skin changes that you didn't see before. And then also you feel inside your armpit for hard lumps, because when breast cancer spreads, it always starts in the breast, and then the first place it goes to before spreading to other parts of the body is the armpit. And so there are actually some patients, particularly patients who have these aggressive forms of breast cancer, that may have very, very small lump inside the breast that is not felt, which can actually spread to the lymph nodes in the armpit. So that's why we recommend that during your monthly breast self-awareness, you also feel in your armpit for lumps and bumps as well. And of course, if you have a lump in there, you don't ignore it. Present your healthcare provider for further action. So this is what you should be looking for: skin changes like a rash, or hard lumps on the skin that were not there before. Redness also, we're dark colored, but you might still see that the skin of the color of the breast is not what it was before, and perhaps darker than the other breast. Also look for nipple dripping or nipple discharge. This is of course in somebody who is not lactating, somebody who is not breastfeeding. If you're seeing bloody nipple discharge, that needs to be evaluated. So bloody or milky nipple discharge in a woman who is far from breastfeeding needs to be evaluated. If you're seeing skin dimpling, so what we call is, a dimple that is the skin of the breast is kind of pulled in or retracted, or looks like an orange peel appearance. An orange peel is very dimpled. That definitely is a cause for concern. That needs to be evaluated. If your nipple was normal before, it was an outward appearing nipple, and now becomes retracted or pulled in, that may be a cause for concern, because sometimes what happens is that there's a tumor behind the nipple that is retracting and pulling on the nipple. And of course, the commonest thing we hear about is a lump. But again, not all breast cancers present as a lump that you can feel. There are many other changes that we need to be looking for as well. So, having said that, again, particularly for the more developed world, where patients are getting screened every year or every other year, majority of patients do not have any symptoms and can't even feel a lump. It is very possible for somebody to not feel a lump and still have breast cancer. And that's why in our clinics where we see these very early stage breast cancer patients, it's a very, very devastating disease, because the woman, essentially goes for her screening mammogram on her lunch break or on her way home. She feels well, doesn't have any problem going on, and then she's told she has something abnormal on the mammogram. Next thing she knows, she's getting a biopsy. Next thing she knows, she's told she has breast cancer. Next thing, she's in my office. I'm telling her she's going to need chemotherapy. She's going to feel sick for several months. She's going to lose her hair. So it can be associated with a lot of anger, a lot of denial, again, because majority of these patients with early stage breast cancer really don't have any symptoms at all. Some patients, particularly those patients in our communities who are not screened, usually present with abnormalities. Again, these are lumps that can be felt in the breast or armpits, nipple changes like I mentioned on the other slide, and skin changes as well. And then if a patient has systemic symptoms, and what I mean by systemic symptoms are symptoms in other parts of the body, so like a cough or chest pain, shortness of breath, which, you know, doesn't go away with a couple of rounds of antibiotics, that could be a cause for concern. If there's a new bone pain somewhere, so not the usual, you know, arthritis that we all have every now and then, but if there's a worrisome bone pain, and, you know, the trick to cancer symptoms are that those symptoms are persistent and progressive. If the symptoms are getting worse with time, they're not going away with treatment, that is a cause for concern. So the areas that breast cancer likes to go are particularly the lungs, and in that situation, if they're spread to the lungs, there could be cough, chest pain, shortness of breath. The liver. The liver sits in the right upper quadrant of the abdomen. So if there's pain in the right upper quadrant of the abdomen here, or if there's nausea or vomiting or unintentional weight loss, you're losing weight and you're not trying to lose weight, but the weight is coming off despite your eating and not increasing your physical activity, that may be a cause for concern. Breast cancer also likes to go to the bones. So like I mentioned, if there's a new bone pain, which is persistent and progressive, it needs to be checked out. And then also breast cancer likes to go to the brain. And symptoms of, you know, cancer in the brain are headaches, particularly headaches that wake you up early in the morning, or nausea, vomiting. You know, there could be weakness in any extremity, so maybe weakness in the arm, or weakness on the leg, or weakness on one side of the body that could mimic symptoms of a stroke. This could indicate brain metastases. So what do you do if you find a lump? So first thing, you know, I always tell people is you need to, you know, calm down, you know, take it easy, don't get all frazzled, but definitely plan a strategy. And why is that? Because actually, most lumps are not cancerous. There are many, many things that can cause lumps in the breast. There's something like that I mentioned earlier called a breast mouse or a fibroadenoma, which is very, very common, particularly in younger people who are still menstruating. That doesn't have any malignant potential. It's not cancer. There are cysts that are very common in, you know, multiple different women. There's a fibrocystic disease of the breast that can be seen in people who take a lot of tea or coffee that has caffeine in it. There could also be infections. There are a myriad of things that can cause breast lumps that are not cancer. But having said that, even though most breast lumps don't end up being cancer, every single breast lump needs to be absolutely evaluated because there's always a chance for breast cancer. So the second thing you should do is seek medical attention. You should go to your family doctor or go to a general surgeon, because, you know, what you would need if you have a lump is you would need first proper imaging tests. Because for instance, if one has a lump and you get a mammogram, a fibroadenoma, which is a benign breast lump, looks very different than how a breast cancer looks. So if you have a mammogram, there are certain characteristics that benign lumps have, which are very different from how malignant lumps look. So if you have a lump, you know, the first step is usually a mammogram. And then if the mammogram comes back looking suspicious, a needle biopsy usually needs to be done to determine exactly what the lump is. And a needle biopsy basically is when, you know, they would clean the area of the breast where the lump is. They will clean it very well so that they wouldn't introduce an infection. They will take a needle which is hollow. They will put it in there and suck out some of that abnormal tissue.